My name is Sheeley. I am the Chief Radiation Therapist at Bothwell Regional Health Center in Sedalia, Missouri. I chose this career path because I've always had a special place in my heart for oncology patients. We've had a lot of family members or family and friends that have had cancer, and there's a beauty in their battle that they fight, and I've just always wanted to be a part of that. To become a radiation therapist, I went to a college in Springfield, Missouri, to Missouri State University. I then went to X-ray school at Cox Health in Springfield. And then I did my radiation specialty through Washburn University. And they call it an online program. I call it an online satellite program because you do your didactic work online and then your clinical work through a specified clinical site. So I completed that in Rolla, Missouri. As a radiation therapist, we deliver the radiation treatments to cancer patients. So in the morning we do QA work on the machine to make sure the machine is giving the proper output, because what we do is very specific and you can't take back a dose, so you have to make sure that everything's operating appropriately. And then our day consists of giving the patients their treatment and also doing simulations, which includes like a CT scan and setting up the patient with immobilization devices and figuring out how we're going to treat that patient. The biggest part includes the patient care that we give our patients. They're going through a really difficult battle, and so the emotional support that we give our patients, we see them 5 days a week from anywhere from 2 weeks to 7 or 8 to 9 weeks. So it's important that they have someone that they trust and that they can come to, because sometimes we're their safe place. The best part of my job is the patients, the relationships that we develop with them, and even when they've completed treatment, they follow up with the clinic for 5 years. So we get to see them from beginning to be on the end, and they're living their normal happy life. My suggestion for someone who's interested in becoming a radiation therapist would be to job shadow. It can be a very emotional job, and we've had people come and job shadow that thought that that's what they wanted to do, and then after seeing some of the difficulties that these patients are going through, they've decided that they can't do that. And then it's also, further inspired people to, that they know that that's what they want to do. And that was my case when I job shadowed. I knew that that was definitely something I wanted to be a part of.